Hello, good evening. Welcome back to I Care for Your Brain with board certified neuropsychologist Dr. Karen Sullivan. That is me. We have been meeting here for almost 4 years on Facebook. Can you believe it? July 24th, 2017 was the day we first decided that we were going to bring evidence-based brain health information directly to the masses. For those of you who don't have access to a solid neuropsychologist, who have brain health questions that you can't get answered, even if you have one, we are here to provide you with a solid understanding of what's going on and what are you going to do about it. It's really as simple as that. So tonight what we're going to talk about is Brain School. Lecture 4 of Brain School is coming up on July 8th. I'm almost sure. Carrie, correct me if I am wrong, if it's July 7th. Things have been very busy here. Lecture 4 is all about how substances affect the aging brain. So what we talk about is the changing relationship you need to have to alcohol, what you really need to understand about prescription medications. We go through 3 very specific classes of medication, over-the-counter medication, that you need to be informed about in order to make the best decisions with you and your doctor about the future of your brain health. We also talk about everyone's favorite question, which is what should I be eating? We talk about the importance of hydration, basically all of the things that we put through our body. And these things are important to talk about because as we get older, there are very normal physical changes that happen to the kidneys and to the liver that really affect the way we are able to all aspects of substances, the way we take it in, the way we metabolize it, the way we hold on to it, and the way we let go of it. So there is a lot to learn. Lecture 4 is probably the crowd favorite in all of the 9 lecture series of Brain School. This is the one that I get the most feedback from, that people say, that was such valuable information. I am making very specific life changes based upon what you had to say in that lecture. So in person, when we've done Brain School, this is the lecture that really gets the crowd riled up. So for any of you who have been with me for the last 3 lectures of Brain School, you know that you get a Zoom invitation to be with me for about a 2-hour live lecture. It's different from Facebook because you get a chance to see my PowerPoint slides, which I take a lot of pride in, which is something that's really not available when we do these Facebook lives. So you get a chance to be a part of the live. You can also get the replay if you're not able to get it then. And you also get a link to a companion workbook. We have worked so hard on these. These took a fair amount of time to put together. Each lecture has a 68-page color companion workbook, and it is all my slides, so you don't have to worry about writing things down. It is full-length articles at the beginning of the workbook. So in this one, we talk a lot about the importance of managing pain with other strategies besides opioids as much as you can. We talk about the MIND diet, the Mediterranean Intervention for Neurodegenerative Delay diet. We talk about that hydration topic that is just so important, especially as we get older. And in the end, we've got trivia, we've got small group discussions if you want to do it with a friend. We've really encouraged that for people to process this information in a social setting. That's like getting a 2-for-1. The general focus of Brain School is that we are really concerned about the aging brain. And guess what? All of our brains are aging. This is even more important if you have a brain health challenge, all the way from Parkinson's to a stroke, to essential tremor, to a learning disability, anything that is unique about your brain. The research suggests that you may have a bit of a steeper slope going into aging. So we want to clarify all of the modifiable risk factors and teach you exactly in a very practical way what the literature tells you that you should be doing. So this one really focuses on the 4 areas of alcohol, supplements, over-the-counter drugs, and prescription medications. So this is important because if you haven't aged yet, okay, so it is July 8th. If you haven't aged yet, well, guess what's coming? Once we get over the age of about 60, we all of a sudden get all of these prescription medications. And if you agree with me on that, let me know. So we, on average, get about 5 new drugs added to our regimen per year for every 5-year span that we get over the age of 60. So most people who are 80 years old are taking about 20 prescription medications. And people can get into trouble here. So what we really just need to do is educate everyone about some very specific risks that go along with very specific medications, okay? And what we talk about is this isn't where you're going to become a pharmacist. You're not going to think I'm your primary care physician. You're simply going to be empowered to bring this information to your prescriber to be able to say, you know what? I really think that this is something that we should talk about. I want to know your opinion and work together as a team. So here's what happens when you take more medications. You're more likely to make an administrative error. You can have too many cooks in the kitchen. I have many patients who've got blood pressure medication from this one, blood pressure medication from this one, and it can get really, really dicey. So we talk about strategies to minimize confusion in your exact regimen. Specifically, we talk about the concern with opioid pain medication. Now, opioids get a lot of press for being misused, related to addiction. That's not what we're talking about. We're talking about people who are not addicted, who need to use these medications because of chronic pain. I want you to understand how they work and how you can develop a better relationship with them where you can take the least amount of medication that you possibly need. But the truth is these medications don't come without significant side effects. So we're going to talk about the risk of falls, the increased cognitive effects that come along with opioids. Then we're going to talk about benzodiazepines. These are things you might take to go to sleep, or if you have anxiety, things like Xanax, Ativan, those kind of things. So we really have to go over that literature to really understand what exactly is known about how they might increase the risk for dementia. And that's really what the whole Brain School series is about, is you have many, many things within your control to reduce your chances of developing all the subtypes of dementia. So learn about them and understand exactly how you can minimize as many as you possibly can. We're also going to talk about the power of respecting over-the-counter medications. We really don't respect them right now. We typically don't add them to our list of meds when we go to see our doctors. And that's because we have this feeling that, they're natural, they're vitamins. Well, my job is to educate you about these very powerful compounds and how you really do need to be communicative with your doctor, about exactly what you're taking. You really need to understand how dysregulated all over-the-counter medications are. They don't have to pass through any efficacy measures to figure out if they actually work. So I'm very concerned about making sure you understand one class of over-the-counter medications called anticholinergics. And this is one of those pearls that over the years, I've had people in tears coming up to see me after lectures saying, I had no idea. Every night when I go to bed, I take a Benadryl. Every night I've been taking Dramamine. I take Tylenol PM. And we have to talk about the time and the place for those compounds. And I can assure you it's not every night, according to the literature. So we're going to talk about the relationship between all these substances and the brain health, brain function, cognitive impairment, all the way up to dementia. I specifically wanted to pay attention to supplements because this is that fuzzy area where they market themselves as being, organic, natural, it's really good for your health. But unfortunately, we have a real lack of evidence that these things actually do much at all for the brain. And it's pretty controversial. And I know some of you are really into your turmeric and to your Prevagen, but I'm gonna, in this lecture, really try to debunk the power of 4 different compounds: coconut oil, turmeric, melatonin, and Prevagen. Now there's one in there that actually is very helpful, but unfortunately many people take it in the wrong way. So we really need to clarify how exactly people should be taking melatonin. Okay, then my favorite part is where we get into the recommendations. And in the recommendations, we really try to help you follow through with what's in the workbook. So for example, I am going to convince you, if you allow me to convince you, that over-the-counter drugs are just as important to tell your doctor you're on. Many of them are blood thinners. There's concern about interaction effects between prescription meds and over-the-counter. So in the workbook, we have a sheet, a chart for you to fill out to bring to your next doctor's appointment with all the things that should be on there, okay? Because they need to understand. So for example, I just saw this question on a stroke recovery group here on Facebook saying, you know, I take Eliquis and I take aspirin and I take turmeric and I take fish oil. Well, guess what? All 4 of those are blood thinners. And the concern is if you get even a little bit of a rough bump on the head, that you may encounter a brain bleed because your blood cannot clot and the brain is not welcome to visitors. It has a very finite amount of space, and if all of a sudden there is new liquid in there, new molecules, blood, the brain is not very happy with that, so we can run into big trouble. So those are the kind of things that I want to enlighten you about. We're specifically going to talk about how much alcohol is okay. We're going to talk about how you should be starting new medications. Going to talk about one very important rule with supplements, which is more is not better. And we're going to talk about how to try to find that really healthy relationship when you do have to take opioids and benzodiazepines, because it's not like there's no room at all for them, but what it is you don't want to just keep taking them and not do the things that are within your control to reduce the amount of milligrams that you have to take or the frequency with which you take it. We are going to talk about the power of what can you do with your body to make sure you are processing and passing substances as well as you can. So that has a lot to do with exercise. So we're going to bring that back to substances. We have been having a great time at Brain School. It's really fun. People at the end get to ask all of their personal questions, and I do my best to answer everybody's question. You get a copy of the live Zoom lecture to keep forever. You can watch it again if it was too much, because it is very dense. I will tell you that. This is basically a brain dump of everything that I know about these 8 very important pillars of brain health. Brain School. So thank you guys so much. We're going to have a link here in the comments. If you haven't signed up yet, I would really, really love to see you there. It's a building community. Each time it just feels like we're learning and supporting each other in more and more important ways. So thank you guys so much, and I'll do my best to see you again next week. Take care. Bye.